Cleat position and lower limb injuries, are the two connected? Well, if you are having pain in your calf, if you're having pain in your Achilles, I would certainly be looking at the cleat position. I'd be looking at the cleat position to make sure both cleats are in the same position. They can move around because we're clipping in and out of the bike all the time. So if one cleat's off center and the other one's centered and you're getting pain in the foot where the cleat is off center, well, true the thing up. I like to bring the cleat back on the shoe as far back as it can come, and then I sit the cleat centrally. That's a good starting point for most people. Another thing to look at is your saddle. So with a traditional saddle, what a lot of people will do is they'll sit off to one side. So one leg now presents longer than the other. They typically sit off to one side because they're trying to protect themselves. So think about, is that something that you're doing when you're riding? Are you sitting off to one side? Because that can cause lower limb injuries as well. Another thing to consider is the age of your shoe. People will change their running shoe on a regular basis. Maybe because we can pick things up relatively cheaply. Pair of running shoes, maybe $150. Pair of good cycling shoes, maybe $450. But some people have their cycling shoes for 5, 6, 7 years. Well, the integrity of the structure is going to give over time. So think about the age of your shoes. Do they need replacing? And the last thing I'd ask you to consider is the amount of intensity that you do in your training. And particularly for long course, for half Ironman and for Ironman training, if you look at the big age groups, you know, they're 30 to 34, 35 to 39, 40 to 44, 45 to 49. We're no spring chickens. It's difficult to come back from a hard session, typically. And, you know, if you're pulling up after a track session or a treadmill session, and you find that you can't walk the next day, or you're having trouble walking, you're in and out of physio, getting massage all the time, are you doing too much intensity? Is that what's causing your lower leg injury?